Welcome to Consulting Chai and welcome to yet another episode on hospital basics. Today we are going to cover about hospital management. And this is the main video. This is the index video and this is linked with every video in this channel. Every video which was uploaded in the past and every video which will be uploaded in future. So let's get started. So hospital management, in my experience, in my view, it can be said in a simple formula of 4 plus 2. So 4 plus 2 formula, we'll talk about that, and then this 6, the 4 and the 2, those are human resource, operations, marketing, finance, infrastructure, and then quality. So let's start. Okay, the first one, 4 plus 2 formula. So to understand this 4 plus 2 formula of hospital management, the four pillars of hospital management, and with the two things, your hospital will run like anything. It will run in automation, it will run freely. Okay, 4 pillars. Without these pillars, you cannot do anything. If any of these 4 are compromised, then your hospital will suffer. First one is human resource. Second is operations. Third is marketing. And 4 is finance. So if you compromise any one of these 4, it'll happen. If not today, after years, if you compromise any 4 of these, you'll start facing a lot of problem in various ways. And in order to strengthen these 4, we have the 2. Number 1 of the 2 is infrastructure. If you have a good infrastructure, the design of the hospital is well planned, then it becomes easier for operations. And the second of the 2 is quality. If you have quality, then most of your operations and most of your human resource will be taken care of. So it's like 20% of your operations and 20% of your human resources work can be taken care by implementing quality correctly. I'm saying correctly. Okay, correctly as in it should be done in such a way that it is sustainable. It's not like you have got your accreditation done and then you have your whole process breaks down. If all the points as per the quality is maintained, then 20% of your operations, 20% of your human resource is taken care of, which will have effect on 80% of your operations and 80% of your human resource. Pareto's law. Okay, and marketing little bit, finance little bit, but very important ones. So we'll talk about that in the later slides. Now let's talk about the first pillar of hospital management, human resource. You have to manage your human resources correctly. So first thing, the most important thing about human resource department work is implementation of organogram. If your organogram is not made, if there are confusions, if there are multiple bosses, then it becomes very hard. There can be a lot of confusions. So a very well designed organogram is very important. It's very essential. Vision and mission alignment. So first thing, I've seen in many hospitals, the top management people, they also don't know and they don't give enough emphasis on understanding the vision and mission. First thing, the owner should be very clear with its mission and vision, and they should make sure that everyone who are working in the hospital should be aligned to the vision and mission. So it is like the whole ship. The hospital as a ship has to move in one direction, and all the crew inside working in the ship should be contributing to the hospital, the ship's direction in the same way. If somebody is trying to use an anchor or break the flow, then the whole thing suffers. Next is staff rights and responsibilities. It is very essential that the staff who are working in the hospital should they should know about their rights and responsibility, like about their leaves, their right to raise grievance, how to handle certain situations, POSH, all this. Then confidentiality agreement. Staff should understand that they are working in hospital, and the confidentiality that they should maintain for the patients, it is very essential. Then they should also understand about their salary breakdown. They should get their salary slip every month. Then KPI JD privileging. They should understand what are their key performance indicators. So on what basis their performance will be evaluated, on what basis their increment will be done. Privileging, what privileges they have got and what privileges they have not got, and what privileges they have got under supervision. All this has to be clear. Then grievance mechanism. So for this, they have to understand the organogram. POSH, very important. So for women's rights and all, POSH is very important for the woman to know this. Also for the other gender, the male, they should also understand about POSH, so they are clear about what consequences they may face. Then comes benefits. All the benefits, like any kind of discounts, any kind of like basically discounts, or in canteen how much they are they can get food for less money. All those benefits should be clear. And then attendance. So attendance, very important. So staff should know that they have to come on time, and on what basis if there is a process for OT, overtime, and they should know about this. Okay. Now the next pillar of hospital management, operations. You have to ensure that the operations department, they are working efficiently, they are working in coordination, they are communicating well. And the first thing about operations here is following the organogram. HR, they have made it, they have approved it. Now it is the operations to implement the whole organogram. Your OPD process. OPD process, you have to ensure that the patients, they are treated well. How the registration is done, how they come, how their queue system starts, how they are done their initial assessment, and then how they go inside the OPD, and then they are done the consultation, then they come out, the whole thing. Then emergency. So when an emergency patient comes, you do triage, then you observe. After a few hours of observation, you either send them to IP or discharge or ICU, wherever as per the condition of the patient. Then IPD billing. It is very important that IPD billing process, they are working flawlessly. There are certain companies, outsourcing companies, where you can outsource your TPA. So they take care of the whole revenue cycle. Then your radiology process, from OPD they go to radiology. So you have to ensure that your patients, they are not waiting without a reason. Okay. The waiting time of radiology also needs to be captured, and after the waiting time, then the TAT starts. So if you're using a system, it's it becomes much easier rather to do it manually. It takes a lot of time to do it manually. Pharmacy process, they come with a prescription. You see the prescription, you either do some audit of the prescription, then you make the bill, then you dispatch the medicine, and inside the pharmacy there are several processes which are going on. For that, please check the previous video of mine which I had covered. So for pharmacy I had covered, you can see that. For radiology also I've covered. Then OT process, OT recently I've covered. You can see that in OT you have your OT schedule is done one day before the OT, and then as per that, CSST, pharmacy, they all prepare, they send medicine to the OT. Patient comes, pre-assessment in the pre-op, then goes to the OT. After the procedure, they come to the post-op. In post-op, after checking everything as per the LRIT score, they are then sent to IP. Discharge process is related to billing. So discharge process, in most of the cases, in many hospitals I've seen, if they have their own discharge, and they take a lot of time in the insurance. So for that, if you have a very well managed company, outsourced company like a revenue cycle management company, they can reduce the discharge time and the acceptability of the bills, the hospital bills, in much more success rate. Okay. Then the MRD process. There are more processes, but these are, I have just covered it. MRD process, how your documents are made. The nursing processes are also there, store processes are also there. Many processes are there. MRD, because medical record is it is the most important document in the hospital. So related to patient. So how the nursing, they are making the records, what records they are, what information they are putting, what the doctors they are writing in the record, and how these records are audited, how it goes to the MRD again checks, MRD they store the records properly, the whole process. Okay, operations, it's actually endless. It's not possible for me to cover everything here in this one video. So for all this, I have covered in many of these departments, and in future I'll also be making more departmental videos. Okay. The next pillar, third pillar, is marketing. So marketing, we have internal and external. In the internal marketing, you have patient feedback. So you need to understand what your patients are seeking for, what they are, where things are lacking. So if you don't understand that, then and you don't correct it, then there's no point of taking feedback. Then apart from the feedback, you need to do prem and prom. So for experience measures, you have prem. For outcome measures, you have prom. So when you do the exercise of prem and prom, you ensure and you have more one-to-one touch with the patient. Okay, so you personally ask these questions to the patients to understand how they are feeling about different aspects inside the hospital, and whether they are satisfied with their treatment or not. Okay, then comes your social media. I've put it as internal because in social media you don't have to go outside there. You're reaching, but when you show what is going on inside the hospital, certain events that you're doing, certain CSR you're doing, the specialties that you have, a lot of things can be covered in the social media. Then your posters and TV display inside. So around the hospital, inside the hospital, any promotional thing that you do, any success stories that you have, or those things needs to be displayed in the hospital. Then your Google review, SEO, so that most of the people who are searching on Google about certain specialty, about certain doctors, about certain hospital, your name will go up in the Google search. So that is SEO. Google review, it is very essential that the marketing people, they are also keeping tab of the Google reviews. They are replying to the things. So who writes in Google reviews? If you talk about patients, there can be only two kind of patient who will write in Google review without telling them to write it. So number one, patient who are highly dissatisfied, so they will put all their anger in the Google review. And patient who are very, very happy, they will write in the Google review. And anything in between, they will not write. Okay. You can also see in many hospitals, the staff themselves, they are writing. Now, external marketing. In external marketing, you have corporate tie-ups. So these companies, you can always tie up with them. You can target those public sector undertakings, and you can showcase about your specialties, the doctors, your equipment, your infrastructure, and then get corporate tie-ups for several discounts. Okay. Then you have your insurance TPA. Insurance TPA, the marketing people, they also work to get more insurance empaneled, so that there are more footfall. Then social media. Now social media external. Here you are talking about your external things that you are doing. Certain CSR I have covered it differently. So in social media also you are covering those CSR activities that you are doing. CSR activities are your CSR activities are your responsibility towards the society. So why not to show that? Why not to make the people aware that this is what we are doing? Okay, Dr. Devi Shetty, he has done a lot of CSR, and through those CSR, he also had a lot of good publicity. Okay, he's a very respectable person, and one of the top doctors in India. Then we have billboards. So certain billboards, you can display about your equipments, about certain specialty that you are having. Okay, so these covers external marketing. Now the fourth pillar of hospital management, finance. So finance, as you know, it is one of the most important thing about hospital management. If you don't understand the finance, if you ignore finance for 6 months, the kind of repercussions that you'll have, it will take years to mend it. Okay, so finance, very important. So to start finance, you have to start with the budget. So the budget will have the whole year's plan in what things, in terms of operations, how much will be our expenses, in terms of your salary, in terms of your variable expenses, in terms of your fixed expenses. You'll also have a certain buffer money. So every month you have to see that those amount that you have budgeted, is it are you consuming more or you are underutilizing it? Okay, and as per the budget, are you getting enough revenue? So that needs to be seen. ROI in capital expenses, like your equipment, are you getting those? Your OPEX, again, it is part of budget. Your operational expenses, you should have good control over that, and there should not be any kind of impulsive buys. Certain equipment, very expensive one, you thought you got a good deal, but without seeing the finances, if you get it, it may backfire. Okay, your reports, financial reports, your monthly reports, your daily reports, all needs to be seen. The finance part, I have covered it in a separate video. You can see that. Then you have your consultants report. Consultants report is very important. Financially, you should see which doctors they are performing well, which doctors they are not performing well. They are not getting more patients. They are not able to. They are not getting more patients. So, doctor's report is essential to basically see for each doctor whether it is whether your finances are in negative or positive. If there are positive, then you will try to help the doctor so that they can do their service better, so that you have more revenue. And if there are negative, then you need to see what are the reasons for that, whether the specialty is right for the hospital or not, and then you can take decisions upon that. Doctors are the key and main people who are actually making the revenue. We are just there to help them and support them so that they can do their work without any worries. Then operational financial indicators. These indicators monthly, they are it is very essential that you see those indicators, like your what is your occupancy rate, what are your average length of stay, your RPOP, your EBITDA. Time to time you need to monthly you need to see. Okay, so if you follow all this, then your finance management is in line. You can have more things here, but these are very basic ones I have covered. Now that we have covered all the pillars, now it's time for the two things which will help support those 4 pillars and run the hospital smoothly. Okay, infrastructure. So this comes way before all these 4 pillars. This is like the foundation. Okay, so if your infrastructure is good, if your design is good, then what happens is your people working in the hospital, they have more independence. They are more it is more easy for them to work, starting from the external layout. External layout, I'm not saying about the look, but it is about the flow of traffic externally. Okay, the site layout, how services are planned. Then inside the hospital, OT design is very important for the NABH purpose, as well as for patient safety. Everything OT design is should not be compromised in any way. So OT is a design. It's not like you just made a modular OT and it is all done. The flow of doctors, the flow of nurses, how your services are flowing, how your consumables, medicines are going, it should be unidirectional. Your biomedical waste, how it is going out of the OT complex, all those things needs to be taken care very carefully, diligently. ICU, another thing, you cannot compromise on this. So for isolations, you have different things. It should have a negative air pressure. CSSD is another very important department. I have covered this. You can see the video there. Then we have emergency. Emergency also I have covered. In emergency, how the infrastructure, it should be accessible. You have to have signages which shouts that this is a 24 emergency place, and if you have any accident, you come here. Then oncology is like a different. For cancer, the whole infrastructure design is different. How the LINAC bunkers, they are designed. For brachytherapy, how it is done. For chemotherapy, how it is done. Okay, then your wards, how your wards are designed. You have accessible ward. You have your corridors with enough width, and your nurse station is well placed. You have a nurse call system there. Ward, how your nursing station is placed inside a ward of 6 beds, 5 beds. Your labor room have LDR layout. I'll cover this. I have not made a video on this. Then your lab is very important, especially how your histopathology lab is designed, how the microbiology lab is designed, how your open system PCR, it is designed. Infrastructure. Radiology, how the radiology department, it is designed. So the wall thickness, the kind of lead sheet that you need to put in the door frame. Okay, then your ramp, nowhere in the NABH book it is written that the ramp is mandatory, but operationally it is very important. So if you need to evacuate your ICU patients, then it becomes very difficult in case of fire. Okay, so for that I also have a video of Code Red where evacuation of ICU patients is done from staircase. Okay, so please watch that video. Fire. Okay, the first one, 4+2 formula. So to understand this 4+2 formula of hospital management, the four pillars of hospital management, and with the two things, your hospital will run like anything. It will run in automation, it will run freely. Okay, 4 pillars. Without these pillars, you cannot do anything. If any of these 4 are compromised, then your hospital will suffer. First one is human resource. Second is operations. Third is marketing. And 4 is finance. So if you compromise any one of these 4, it'll happen. If not today, after years, if you compromise any four of these, you'll start facing a lot of problem in various ways. And in order to strengthen these four, we have the two. Number one of the two is infrastructure. If you have a good infrastructure, the design of the hospital is well planned, then it becomes easier for operations. And the second of the two is quality. If you have quality, then most of your operations and most of your human resource will be taken care of. So it's like 20% of your operations and 20% of your human resources work can be taken care by implementing quality correctly. I'm saying correctly. Okay, correctly as in it should be done in such a way that it is sustainable. It's not like you have got your accreditation done and then you have your whole process breaks down. If all the points as per the quality is maintained, then 20% of your operations, 20% of your human resource is taken care of, which will have effect on 80% of your operations and 80% of your human resource. Pareto's law. Okay, and marketing little bit, finance little bit, but very important ones. So we'll talk about that in the later slides. Now, second of the two of 4+2, quality. So quality will make sure that your hospital is functioning in the right way, how it should, in terms of operations, HR, and especially in terms of operations and HR. It also covers something about marketing and as well as finance. I have made this video before, so you can go and check implementation of NABH part 1 and part 2. There I have covered everything in detail. All these points I have covered it in those two videos, so you can go and check that out. Here I'll just tell you briefly. Okay, so quality will start with the committee meetings. You have your organogram. In organogram, your committee should also be there. Okay, what are committees? Committees make sure that everything about the operations and quality, those are taking place and the hospital is going on the right direction and all together. Okay, so you have a lot of committees like your drug and therapeutic committee, infection control committee, medical record committee, condemnation committee, mortality committee, code blue committee, lot of committees. So all these committees, they will do their meeting, and the chairman, they are for advisory roles. Secretaries are the main people who will be running around getting things done. So in all the committee meetings done periodically, they have certain agendas to talk, and certain decisions are made. Okay, so these committees, they will make all the decisions and get things done. The secretary will ensure that those things are done, and after every meeting, at the end of the month, the last week, say for example, in the first 3 weeks you do all the meetings of all the committees, and in the last week, first of the last week, first few days of the your last week, your quality committee meeting is conducted, where all these committee secretaries, they tell about their findings and they contribute, they raise the issues. Okay, so the quality team, they compile everything, they try to resolve it on their own, and anything where the management's permission decisions are required, where there are certain major purchases required, those things are compiled by the quality committee, and then they discuss about that in the management review meeting. Okay, the apex committee. So this is how the whole thing, there are thousands of points to be implemented for NABH, or there are thousands of things which are always coming up in hospitals. So those things needs to be discussed like that, so that the management, they have very less things to discuss, and very important things to decide. Okay, then you have your infrastructure in terms of your infection, how it is done, your patient-centric. It is a patient-centric and safety during emergency cases. So these things are ensured by the good infrastructure. Quality, how it contributes to infrastructure is whenever, say for example, a hospital is made with good design, everything, but then you feel that there is a need of putting some department. So that time the quality part of infrastructure comes in. Okay, so you also need to do some assessment, risk assessment, in case you are thinking about certain infrastructural development. Okay, then you have your documents, manuals, SOPs, policies, very important, so that things are written down and it is available for the staff to refer to, and that is how they are supposed to work. Okay, then your forms and formats, your checklist, assessment sheets, consent forms, registers, all that, statutory compliances, your licenses, certificates, part of quality, MOUs. So quality says that you need to have MOU for everything that you are outsourcing. So if in case there are any litigations or any problem, any disagreements, you should always have a written document where you can fall back and refer to. HR trainings is very important. It is a intersection of HR and quality, which I had covered before. Then your emergency codes, so management of emergency situations, your color codes like red, blue, pink, violet, orange, yellow, black, all that. Incident reporting is something that will actually improve your hospital. Okay, so near miss, no harm, adverse event, sentinel event. You can just simply ask a hospital how well they are doing there, how much near miss incidents are reported. By that you will understand that the actual quality has been implemented or not. Okay, then there are quality indicators. There are 32 basic quality indicators and 8 additional quality indicators for clinical quality indicators. And as per the scope of services, you have those quality indicators. Then comes your report, your quality report, quality assurance program report, water test report, your quality project report, your active audit report, passive audit report, pharmacy, your prescription audit report. So a lot of reports. Okay, then audits, your clinical audit, passive, active audit. From those audit, the report will be generated from these audits: active, passive, nursing audit, prescription audit, NABH audit, recurring activities. So this is the list of all the activities that needs to be seen periodically. You have this is a tool that I've developed in my last organization, in my last experience, that we need something to check whether those things are done or not, because in many times I've faced this problem that I've said something that please do this, please do active audit. They have done once, they have shown me once, okay. After 3-4 months when I go back, then I've seen that those things are not done. not on monthly basis. So for that you have recurring activity checklist. So this is it for quality. So thank you so much for watching this video till the end, and please comment, like, subscribe to this channel, and please support so that I have some motivation to make videos more and more. Okay, see you soon. Thank you.